Daratumumab, which is a monoclonal antibody against CD38, is a good option for a non-chemotherapy regimen in AL amyloidosis. Same for Isatuximab. Isatuximab, which was recently FDA approved here in the United States, and there is a SWOG clinical trial that focused on the efficacy of Isatuximab in a single agent for AL amyloidosis. Those are very good non-chemotherapy options. We have other options, hopefully in the future we might have other options for the treatment of AL amyloidosis. I would like to mention Venetoclax. Venetoclax is a BCL2 and targets BCL2, and it's very effective in multiple myeloma with a translocation 1114, especially in combination with a proteasome inhibitor. I think that Venetoclax in combination with a proteasome inhibitor, or maybe even alone, is also a good option for AL amyloidosis carrying the translocation 1114. Keep in mind that up to 60% of the patients with AL amyloidosis have this translocation. Currently, we have only anecdotal retrospective reports on the efficacy of Venetoclax in AL amyloidosis, but those reports are very impressive. And I would guess that in the future, we might use Venetoclax with a PI, with a proteasome inhibitor for relapse refractory, and potentially even in other combinations, for instance, with Daratumumab for newly diagnosed. But I think this is still future music. Right now, we unfortunately can only use Venetoclax in selected cases. It's not approved in any country for this indication, and probably very often insurances might not agree to use Venetoclax for AL amyloidosis. I also want to mention monoclonal antibodies that directly target amyloid. This is also an exciting development. Unfortunately, NeoD001 failed in showing efficacy in destroying amyloid. Right now we have KL101, which is another monoclonal antibody that targets directly amyloid in clinical trials. Data from a phase 1a/b clinical trial showed a 67% organ response, but ongoing phase 3 clinical trials need to show whether this monoclonal antibody is able to significantly reduce the amyloid burden in our patients.